Good afternoon, Facebook. Thank you all for being here with us this afternoon. I've got a special guest this afternoon on this Facebook Live post. And today we're very pleased to have Dr. Fred Eccles here. Dr. Eccles is the head of our health department here in St. Louis, and he has been leading our public health effort during this entire pandemic. He's got about 10 or 15 minutes here. I'm going to ask Dr. Eccles to update you, and then he can take a couple of questions, and then I'll come back in and take more questions from you. So Dr. Fred Eccles, medical doctor, trained in the Navy, former head of communicable diseases for the state of Illinois, also worked for the St. Louis County Health Department. We are really lucky to have him leading us through this effort. So with that, I'm going to exit stage left and bring in Dr. Eccles. Thank you.
Good afternoon, everyone. It's a pleasure to update you on the city's response to COVID-19. As of right now, we have 482 confirmed cases of COVID-19 in the city of St. Louis. However, in the region, we have over 2,000 individuals that have tested positive for COVID-19. In addition to that, we have over 30 individuals have died associated with complications of COVID-19. So this is a rapidly evolving situation that requires community involvement. And so our role as a public health department for the city of St. Louis is to make sure that the community is informed and have accurate information available so that they can protect themselves, their families, and the community at large. There's a few special initiatives that the city of St. Louis is putting on to bolster our response or enhance our response for COVID-19. One is identifying vulnerable populations within our community. One of those vulnerable populations are the elderly as well as unhoused individuals. For the elderly, the City of St. Louis Department of Health has been working with long-term care facilities, providing them with PPE, education, as well as information on how to properly implement proven effective control measures that have been issued by the Centers for Disease Control and Prevention. In addition to that, we're also working with them closely to monitor individuals within their facility that may develop symptoms associated with COVID-19 to ensure that they can be linked to medical services and medical care in a timely manner. For unhoused individuals, the health department is working really closely with the Department of Human Services, as well as community stakeholders, which includes our continuum of care, as well as some subrecipients that provide housing for individuals across the St. Louis region. And this is important because the unhoused individuals are very vulnerable and they're susceptible to not only getting infected with COVID-19, but also spreading it rapidly amongst the unhoused population. And so to address this issue, we're working with, again, housing agencies, homeless service providers across the region to link them to housing. The federal government has provided assistance in the form of a mega waiver, which allows us to more rapidly link these individuals, link unhoused individuals to care and to housing. And so we'll be utilizing that as best we can to more rapidly, again, link individuals who are without shelter, without homes, to housing. Because housing in itself is a prevention measure that is often underrated and underutilized. And so we're doing our best across the city of St. Louis to make sure that we utilize the federal resources and city resources that we have available to link individuals to housing. We're also working with the state. The state has agreed to provide the city of St. Louis with an Abbott rapid test machine, as well as cartridges. And this will allow us to screen individuals more rapidly. So we have individuals who may have been exposed to COVID-19, to someone that's infected with COVID-19, and we're able to screen them and get them either back to the workforce sooner, or if they screen positive, we can make sure that they're properly isolated in the community to prevent and slow the spread of COVID-19 in the city of St. Louis.
All right, thank you, Dr. Eccles, for joining us today. We do have a couple of questions. One of the ones that came from Facebook from Russell, he would like to know if the city is keeping track of the number of those who have recovered from COVID-19.
So as part of our monitoring process, we identify all contacts as well as individuals who are confirmed to have COVID-19. And so we track this data day in and day out to make sure it's as accurate as possible. We will continue this process until the COVID-19 response is over. And even after this the COVID-19 response is over. The Centers for Disease Control and Prevention deems this to be a reportable condition. After this response, we'll continue to monitor individuals and make sure they're linked to medical services.
You mentioned contact tracing in your last answer. Can you kind of talk through how the health department does that? What resources are used to make sure that we're reaching out to all those individuals?
Absolutely. Contact tracing is really important. This is not a new tool that we're using. We use it for sexually transmitted infections and other diseases such as mumps and measles. And contact tracing allows us to not only identify who the case is, but also to identify other individuals that may have been exposed to this individual. And so whenever we receive a report of someone who has tested positive for COVID-19, we work with them to identify who their close contacts may be. And we specify close contacts because according to the CDC's definition, individuals who are identified as close contacts are those at greatest risk for actually becoming infected. CDC's current definition is for close contact includes individuals who spend a prolonged period of time in contact with someone within a distance of less than 6 feet. And the other part of the definition includes individuals who may have been directly exposed to mucus secretions for an individual. For example, if someone coughs directly on you and they're infected with COVID-19, then you'll be identified as a close contact.
Great. We have another question. What should one do if they believe that they are experiencing some of the symptoms of COVID-19? What steps should those individuals take?
Individuals who are exhibiting symptoms similar for COVID-19, they should contact a medical provider first. If you're living in the city of St. Louis and you don't have a medical provider, you should contact your local health department, which is the City of St. Louis Department of Health. And our contact number is 314-657-1499. Again, 314-657-1499.
We do have a follow-up question from earlier. You mentioned the process of the contact tracing, and we're contacting those who have been recovered. Do we have a number yet on how many individuals in the city have recovered?
So we're working to tease out that particular data, but what we're seeing across the United States is roughly anywhere from 85 to 90% of individuals that are infected with COVID-19 actually recover or have minimum mild symptoms, but the majority of individuals actually recover.
Awesome. So can you talk about the curve? Is it bending in the city yet? Are there projections on maybe when that might be happening, if not already?
For some of the community mitigation strategies that have been implemented for the city of St. Louis, for example, the stay-at-home order, school closures, closing some establishments, has allowed us to push the peak back a little further. And so what this has allowed us to do is protect our healthcare workforce, as well as the public health workforce across the St. Louis region. And how this works is, if we implement these community mitigation strategies, we slow the spread of COVID-19 in our communities, then that results in a slower rate of rise, a slower increase in the number of cases, which again helps us protect our healthcare workforce because we have fewer individuals actually being hospitalized or diagnosed with COVID-19, and then our healthcare workers are less exposed otherwise than there would be if we weren't implementing these community mitigation strategies.
Great, thank you. Dr. Eccles, can you talk about whether they're coming in from those private labs or doing it at our hospital systems? How are we getting in those numbers and how are we reporting those numbers out?
All right, so for the state of Missouri, mandated reporters are those agencies that are required to report reportable communicable diseases to their local public health agency and the state Missouri Department of Health and Senior Services. And so all laboratories, private and public, are reporting, as well as our medical providers. So all hospital systems, private practitioners, urgent care centers are all deemed to be mandated reporters. And so they submit the information according to the state's regulations, which is immediately as soon as possible within 3 hours.
So the city is obviously under a stay-at-home order right now. Do you expect that to be extended?
What we're currently looking at is the data. And so the City of St. Louis Department of Health is adamant about implementing data-driven processes. And this is important because we want to make sure that we're utilizing our resources as best we can. Our resources, the majority of the resources that are provided to the City of St. Louis Department of Health are through taxes that are generated through the city. And so we want to make sure we're good stewards of taxpayer dollars. So utilizing data allows us to not only identify the best mechanism to actually implement the initiative, but we also want to make sure we're targeting the right areas. And so, based on what we're currently seeing, with the increase in cases daily, as well as the increase in the number of deaths daily, it is likely that we will need to extend the stay-at-home order. However, things may change, and so we continue to monitor the situation daily, and we will be implementing a data-driven and academic process to determine whether or not to extend the stay-at-home order for the City of St. Louis.
Dr. Eccles, can you speak kind of more broadly why both social distancing as well as this stay-at-home order is so important during this particular pandemic?
So social distancing and staying at home helps slow the spread of COVID-19. The intent of the order number 5, which is the stay-at-home order, was to maximize the number of people that stay at home to reduce the spread of COVID-19 in our jurisdiction. Social distancing, so maintaining a space of 6 feet between you and another person, works in 2 ways. So if they're infected, it reduces the likelihood that others will be exposed to their infected respiratory droplets. And for those individuals who are not infected, it prevents them from being exposed to an infected person's infected respiratory droplets. And so it works both ways. So, and for the staying at home piece, so a lot of times during this particular season, there's a lot of upper respiratory illnesses that are going around. And so if individuals that are ill, it's important for them to stay at home to prevent exposing others in the community, especially their co-workers and individuals that they may come in contact with on a regular basis. So overall, the stay-at-home order is to, again, reduce and prevent the spread of COVID-19 in our jurisdiction.
Why are certain stores staying open in this order? Sarah has asked that on Facebook.
So the other goal, again, the other goal of order number 5, as I mentioned before, is to not only maximize the number of people that are staying at home, but we also want to limit the number of people that are out in the community. And when individuals are out in the community, social mixing can occur. And so oftentimes individuals may not know that they're infected with COVID-19, but when they gather in groups, whether it's at the workplace or at other social places, there's a chance that they can transmit COVID-19 to others around them. And so our goal is really, again, to prevent the spread of COVID-19. And these community mitigation strategies have been proven to be effective. We utilize them year in and year out for seasonal flu, and we have strong evidence that they are effective. And as long as they're implemented, they'll be effective in preventing COVID-19 cases in the City of St. Louis.
Dr. Eccles, in your assessment, can you compare how the City of St. Louis and the region itself is faring with this pandemic compared to other regions in the country?
So at this point, a lot of jurisdictions are struggling. As we see in the St. Louis region, the epicenter, so the urban areas are most heavily impacted. For example, St. Louis, the City of St. Louis and St. Louis County have the highest number of cases in the St. Louis region. However, what we're seeing is that as time moves forward, as COVID-19 spreads amongst communities, the trickle effect happens. So it spreads beyond the borders of the City of St. Louis County, St. Charles County, Franklin County, Jefferson County, et cetera. And so it's really important, again, for these community mitigation strategies to be implemented and for people to really adhere to those simple measures that we remind them of every single day. Staying at home if you're ill, covering your mouth if you cough or sneeze, washing your hands regularly with soap and water, using hand sanitizer if soap and water are not available.
Tracy would like to know on Facebook, what is being done to help those who might find themselves unhomed in this pandemic?
That's an excellent question. So as I mentioned before, the federal government, particularly the Housing and Urban Development Department, has issued mega waivers, which allows us to more rapidly link unhoused individuals to housing. And so there's a lot of different categories within the housing that the city receives from the federal government related for housing. And so we're working together across agencies for the City of St. Louis government, as well as working with our community-based organizations to make sure we use these this funding effectively and efficiently to house individuals.
Dr. Eccles, Monica on Facebook would like to know if you could address the disparity between the higher rates of death nationwide for African American communities versus other communities.
That's an excellent question. And so when we look at health disparities and health inequities that exist within the city of St. Louis, it's not unique. These inequities exist across the United States, across the world, and has posed a challenge for public health agencies and other government agencies as well. And so we've identified this as a huge issue for the city of St. Louis. And one of the things I want individuals to be mindful of is that the health inequities and disparities that exist are pre-existing, so meaning that they existed before COVID-19 happened. And so what we're charged to do as a health agency is really to address those issues, ensuring all individuals, regardless of race, socioeconomic status, income, educational attainment, have access to quality health and health-related resources. This is a priority for us because our community is only as strong as the weakest link. And so if we aren't providing those individuals who are deemed to be economically disenfranchised, or those who are uninsured with proper resources, then we're not doing a good job. And so the priority for the health department is to implement an equitable practice, meaning that individuals receive the resources that they need. That means that some individuals may need more resources than others, but if we're able to meet their need, we can help empower them so they can live healthier lives. But again, it's really important to understand that the health inequities and disparities that we see in the city of St. Louis are not new. These are pre-existing, so this is decades in the making. And so in order for us to really effectively change what we're seeing, we have to be strategic and really be purposeful about not only linking individuals to quality health and health-related services, but also need to give the community a platform, giving them a platform to let us know what their issues are, but not going beyond that, and also developing actionable steps related to that. And so making sure that the community's input is actually incorporated into our decision-making process so that we can truly meet their need. And as we look at some of the data related to COVID-19 in the city of St. Louis, it's really important that we understand and we tell the story about why African Americans are being more heavily impacted than other groups, and that's related to health access, lack of health access. It's also related to some cultural norms that have established within the minority communities. For example, oftentimes individuals may not seek medical care because they don't think they can afford it, and they may just deal with the illness on their own or rely on other means rather than seeking medical care. But in the city of St. Louis and in the St. Louis region, we are rich with resources, but the issue is not all community members know about those resources. And so again, part of our job as the health department is to make sure every person in the city of St. Louis knows what resources are available to them so they can take advantage of them.
Dr. Eccles, Robbie wants to know, and this is going to be our last question for you. If someone comes forward and they're found to be positive, or maybe through contact tracing, someone is given an official quarantine, what systems or measures are in place to ensure that those individuals are actually staying home?
That's a great question as well. So part of our protocol with the City of St. Louis Department of Health is when we are notified of an individual that has been exposed to someone with COVID-19, or someone has tested positive for COVID-19, we enroll them into our self-quarantine or self-isolation program. And it's important that I distinguish the difference between quarantine and isolation. Quarantine is just someone that has been exposed, but they have not tested positive for COVID-19 or another illness. For isolation, we know the cause of their illness. So these individuals that are ill, they have tested positive, we know the cause of their illness. So for our self-quarantine / self-isolation program, we enroll individuals into the program, and at the very beginning, we provide education to each and every person. This is really important because it's necessary that they understand why we need them to self-quarantine for the 14-day period. And so to make sure that they understand that we go through the different steps of self-quarantine, we provide them with resources, whether it's temperature, thermometer, they need hand sanitizer, other resources. We provide that to some individuals as well, depending on their need. And we monitor them for the 14 days. In the event that someone tests positive within that 14-day monitoring period, we link them to medical resources, which includes testing and other resources so that they can be properly diagnosed and moved into our self-isolation program if necessary. Our isolation program, as I mentioned before, is for individuals that are confirmed to have COVID-19. And so these individuals are quarantined for a period of time, but prior to returning to work, they have to receive clearance from a medical provider to return to their normal activities, which includes returning to work.
Thank you, Dr. Eccles.
Good afternoon, Facebook. Thank you so much. I hope that you enjoyed hearing from Dr. Eccles. He's really an expert in this field, and we are very lucky to have Dr. Eccles leading this effort. There are a couple of things that I want to visit with you about today that I want to be sure you know, and that one of them is that we have opened today a third testing site in North St. Louis, and this is a CARE STL site. The address is 2425 Whittier, and the phone number for that testing site is 314-367-5820. That is the same phone number as for the other CARE STL site, which is at 5471 Martin Luther King. And then finally, and I think you all know this unless you're a new viewer, there is an Affinia testing site at 1717 Biddle, and the number there is 833-2777. So it is important that if you feel that you have been exposed or have symptoms of COVID-19, that you first contact your own doctor if you have a doctor. Secondly, that you contact your own federally qualified health center if you are a patient of that FQHC. Third, you can contact one of the 3 testing sites that I just told you about. And of course, fourth, you can contact our health department, which is 657-1499. So that is a bit of new news that I wanted to make sure you had today. One of the other things that has come out today that I want to give my full endorsement of is the UFCW, United Food and Commercial Workers, has called for everyone who's going into a grocery store or a store in order to buy food or your necessities that you wear a mask. And I endorse that. I think it is the cloth masks that some people have now will help to protect the grocery store workers. And the grocery store workers as well are wearing masks. I'm sure that you've seen that recently if you've been into the grocery store recently. Now, I will take this opportunity to say, don't go to the grocery store unless you really have to. And get your list together. Only go once a week or hopefully once every other week if you can stretch your list that long. And go by yourself so that you, if possible. We know some folks may have to go with somebody else because of maybe it's someone who needs to take their kids with them, but if you can, try to arrange to go to the grocery store by yourself. That way, it's easier to socially distance, and it's safer for you and for the workers in the grocery store. So I want to just give my full endorsement to that. The third thing that we are working on now is that we know that there are a number of people in our community who do not have access to the internet. And so we are, today I called on AT&T, T-Mobile, and Verizon to try to make their internet access available for free during this time of a pandemic. We don't have that yet, but I do think it's important to call for that and try to see. Robert Gaskell Clemens is our Chief Technology Officer here, and so we are trying to work that out. There's a couple reasons that's important. One, telemedicine is a real thing, and you can talk through, many insurance companies will provide you with a doctor to talk through telemedicine, but you need access to the internet normally. And of course, you also need a device. So we're trying to bridge that gap, the digital divide, as we say. The other thing is we have a lot of school kids who are at home now, and trying to do learning and on the internet. And so having that access to broadband access will be very important to them. And then, of course, just staying up on the latest with regard to COVID-19. So those are three new things that I wanted to mention to you today. Dr. Eccles has given you the numbers and I think given you a really good summary of where we are right now. But I'm happy to take questions if there are questions.
Mayor, we got about 5 minutes left for questions that are rolling in on Facebook. Tracy would like to know the new facility of the former Little Sisters of the Poor. What's the timeline for that? When should that be ready for people to come in?
So the former Little Sisters of the Poor, on Monday, we moved about 15 individuals there. And then tomorrow is when we are working with the COC. There's supposed to be a call, the continuum of care. There's supposed to be a call tomorrow in order to figure out an orderly way to get folks into the Little Sisters of the Poor site. I will tell you that yesterday we have some folks that are camping out in downtown, and some of you may have seen that. They're right across the street from my office here. I think there's a little messaging going on there. Yesterday we sent our outreach workers as well as my chief of staff out to talk to every single person who was there. There were only 3 people yesterday who were willing to be put on a list to go into shelter. And so that's always a challenge, especially in the nice weather that we're having right now.
Mayor, Joyce would like to know, how is the city working on getting all of this information out? Obviously, you're doing your Facebook Live, but what are your strategies in getting the word out?
You know, getting the word out, Joyce, is it's a challenge because we're all getting our information from so many different places. So that's why we do Facebook Live. Appreciate all of you who are watching. Hope that you will share this on your Facebook page so anyone who's interested can take a few minutes and look at the highlights of this. We're also do a lot of social media on both Twitter, Facebook, Instagram. But in addition to that, you've seen me probably if you watch any of the major news stations, 2, 4, or 5, or listen to the radio, whether it be St. Louis Public Radio, KMOX, 107.7. I've been on any number of radio stations. We're trying to use every method possible to get the message out that it's us, it's each one of us that can change our behavior to slow the spread of COVID-19. And so it's so important. I call on everybody who's on Facebook today who understands this, go out and tell 5 people who maybe don't know. Call them up on the phone. Can't go to their house. We're not going to do that gathering. Call them on the phone and say, just to make sure that they know how important this is. And also remind folks that includes their family members who are not in their same household. Grandparents, unfortunately, right now, can't really see their grandkids who don't live in the same household because you just don't want to have that social mixing because you don't know who's possibly picked up the bug, the virus somewhere else, and you just can't risk that community spread that occurs. And I know that's very tough for people not to be able to see their family members during this time, but it is really for our own health that we don't do that.
Mayor, is the National Guard planning to come into the city of St. Louis?
So maybe. The National Guard, a week or 10 days ago, the governor called up the National Guard. And as we look ahead at the trajectory of the number of folks infected, it may be necessary to have the National Guard help us do transportation, perhaps, and some other logistical things. And that's something that they are very good at. Right now, that is not happening, but we're looking ahead. The projections, the model says that as many as 80,000 people in our region, in this 14-county region, Missouri and Illinois, could be infected with COVID-19. That's a lot of people. We're looking at possibly anywhere from 1,300 to maybe as many as 3,000 people being hospitalized. Yesterday, the number of people hospitalized, I hope I have it written here, was, I'm going to go on my memory here because I don't have it in front of me. Oh, here it is. 586 people were hospitalized with COVID-19 as of yesterday in this region. And that was announced by Dr. Alex Garza, who is the incident commander for the St. Louis Metropolitan Pandemic Task Force. And he'll be talking again at 3 o'clock. You'll have some updated numbers today. I think it is fair to assume that the number of people hospitalized today is more than it was yesterday. So we are just using all means and methods to keep everyone as safe as possible.
Mayor, so we are right at 2:30, so I'm going to ask one last question.
Okay.
Can you talk about the services in City Hall? What is open, what isn't open, what city functions are still happening?
Well, thank you for that question. City Hall is closed to visitors. And when I say City Hall, I mean this building that I'm in today, but I also mean 1520 Market and the Water Department and the Street Department. They are closed to visitors inside the building. If you have something that you need to drop off, you can open the front door to City Hall. There's a bin, a mailbox, if you will, for every single department. So you can still drop things off here. The department picks that up as mail a couple of times a day. City Hall and all of our departments are operating on a very skinny skeleton crew. And we think that's necessary so that we can also do the social distancing. Now that's true of the folks who work in these buildings, but it's not true of our police officers, our firefighters, the folks who pick up the trash, the folks who run the water department. All of those people are working, and they're working hard because they provide essential services for you. We can't stop picking up the trash. You all know that. Our alleys would be a mess in no time. And so I just want to say thank you to all the city workers and all the hospital workers and the grocery store workers who are continuing to work during this very, very challenging time. So thank you all. Appreciate you being with us today.